Hi everybody, Dr. Dan Williams back with you, and I want to talk with you today about rotator cuff injuries. So a couple things set us up for rotator cuff injuries. The first is that we use our shoulders all the time. So it's very easy to injure our shoulders. You know, we fall, we catch ourselves, we're in an accident, we sleep on it, we lift our children, our grandchildren, carry the groceries, carry heavy objects. Many things can strain the rotator cuff. But even if we don't strain the rotator cuff, many things can injure the ligaments or the rubber bands that hold the bones together. So what happens is when we strain the ligaments or the rubber bands, then that allows a little bit of joint play. Lets that joint be just a little floppier than it should be. Now, as you know, we don't walk around with floppy joints, so the muscles and the tendons have to make up for it. So what happens, those muscles and tendons, they put more tension on themselves. The muscles get tight, we get trigger points, we get pain. But we also then start to set up those tendons and ligaments for injury. So the second factor that sets us up for rotator cuff injuries is that we have fairly poor blood supply to the rotator cuff, and that blood supply gets worse as we age. So now those injuries have minimal chance of healing on their own. So what do you do about it? Well, many people try anti-inflammatories, steroid injections, physical therapy, and even surgery. The problem is there's a fairly high failure rate for surgery for rotator cuff tears. So you say, well, what are we supposed to do? Well, first off, if we can catch things early, hopefully we can prevent it from getting that far. But even if you have one, there is some new technology that can help us repair that shoulder. Typically, I like to do that with two things, either prolotherapy or PRP or platelet-rich plasma. So in both of those injections, they're a little bit different. We have other videos on that I encourage you to look at. But both of those treatments focus on helping your body go into that damaged tissue, repair the damage in the torn ligaments and tendons, and then helping your body repair that injury on its own. Sometimes we do need to repeat the treatment a couple of times, 2, 3, 4 times, but we're getting outstanding results with rotator cuff tears, labral tears, and other types of damage and injury to the shoulder. So if you're suffering from shoulder pain, I encourage you to seek out a physician that is trained in regenerative medicine, prolotherapy and PRP, osteopathic manipulation, because again, those make sure that they're functional. When we're going in there and trying to help your body help itself, we want to make sure that we're setting you up for success. And that means we want to take every advantage. Osteopathic manipulation, functional medicine, nutritional medicine to make sure that your body has what it needs to come in for the repair process. And finally, acupuncture can be very beneficial to help with trigger points, help with pain, and help expedite the healing. So if you have rotator cuff problems, and you're wondering what to do about it, before you make your decision, I encourage you to explore the regenerative medicine field and look at prolotherapy and platelet-rich plasma and see if they can be beneficial. If I can help you, reach out to me on the internet or call our office at 317-660-0888. Bye-bye.